Hi, my name is Carly Kelly, and today I'm going to be talking to you guys about some of the strengths and weaknesses of telehome care. To begin, I have defined telehome care as a subfield of telehealth that uses telecommunication technologies and devices to provide healthcare services to patients in the comfort of their own homes. As one of the newer forms of healthcare, there is a substantial amount of research being done to determine the effectiveness of telehome care. By looking at the most current research on telehome care, healthcare providers can decide whether or not they would like to adopt this practice into their list of provided services. This presentation will work as an outline outlining the major strengths and weaknesses of the telehome care services. Before I begin outlining some of the strengths and weaknesses, I would like to share some of the current research being done on telehome care. First, an article by the name of Home Telemonitoring for Chronic Disease Management and Economic Assessment, published by the International Journal of Technology Assessment and Healthcare, studies some of the economic effects of this form of healthcare. This study observed 95 patients with varying chronic illnesses over a 21-month period to determine the potential financial benefits of telehome care. This study also found other potential benefits from using telehome care, including fewer hospital visits, shorter length of hospital stays, and fewer emergency room visits. Contrary to researchers' hypothesis, however, the study found that telehome care resulted in a higher number of home visits by nurses during and after the implementation of telehome care. Overall, a 40% decrease in healthcare costs were observed when compared to traditional forms of healthcare. Researchers attributed this significant decrease in healthcare costs to the dramatic decrease in hospitalizations and hospital visit stay times. Another article published by BMC Health Services Research called A Multi-Level Qualitative Analysis of Telehome Care in Ontario, Challenges and Opportunities, presents some of the barriers and opportunities that come from telehome care. For this research, a series of interviews were conducted with major stakeholders in the use of telehome care. These stakeholders included patients and informal caregivers, healthcare providers, technicians, administrators, and decision makers within 3 different local health integration networks in Ontario. This research focused mainly on the barriers of implementing an effective telehome care system. Some of the barriers mentioned include language barriers, lack of access to technology necessary for health assessment and treatment, and telehome care provider time restrictions, and restrictions in healthcare provision for patients. The last article, published by the National Institute of Health, studied the effects of psychotherapy via telehome care for depressed older veterans. This study was conducted on United States veterans ages 58 or older who were diagnosed with major depressive disorders. The subjects were randomly assigned behavioral activation for depression either via telemedicine or in-person therapy. The results of the study showed that telemedicine proved to work just as well as in-person counseling. These results showed that telehome care can be a viable solution for geographical or physical barriers preventing older Americans from receiving the psychological help they may need. Now that I've shared with you some of the research on telehome care, I would like to outline some of the strengths of this healthcare practice. One of the obvious benefits of telehome care is the ability for patients to remain in their own homes while receiving healthcare services that they need. Obviously, having the ability to remain in one's own home can bring a sense of familiarity and comfort, which can be important to somebody who is sick and in need of healthcare services. Another strength of telehome care would be allowing for convenient and accessible care. Lack of proper access to healthcare seems to be a growing issue in recent years due to the aging population and their inability to transport themselves independently from place to place. After review of a substantial amount of evidence and research, it seems that patients had an easier time accessing the information they needed for their chronic disease management through a remote patient monitoring program or another form of telehome care than the patients who use traditional methods of healthcare. Access to care and satisfaction was also significantly higher in patients receiving telehome care after their first hospitalization compared to patients receiving traditional healthcare methods. Bringing healthcare to the patient rather than making the patient come to the doctor's office or other healthcare facility has shown to increase the chances of an individual seeking healthcare to manage acute or chronic illness. Patients may neglect their healthcare needs because of time restriction, traveling inconvenience, or lack of transportation altogether. Telehealthcare can help to bridge the gap for patients encountering these obstacles, allowing them to receive the care they need in the convenience of their own homes. In the rural United States, there are about 43 healthcare specialists per 100,000 people. This means that patients in the rural U.S. that seek treatment from specialists would need to travel long distances or endure long wait times in a specialist healthcare facility. However, with the use of telehome care, specialists easily reach more patients who can ask questions, receive adequate assessment, and get prescriptions or advice for their condition from the comfort of their own homes. Another benefit of telehome care is its cost efficiency. One of the most important benefits of telehome care is the significant cost reduction it provides. By providing reduced transportation costs, reduced emergency room visits, fewer hospital stays, reduced hospital stay time, telehealth care is proven to be much more cost effective for both the patient and the healthcare agencies that are involved. Because patients are able to conveniently ask questions, receive medication reminders, and receive home visits, with the use of telehealth, it has become more likely that patients stay up to date on receiving information reflecting the newest research available to the healthcare workers. These proactive steps decrease the number of hospital visits and stays, which can be the most expensive part of managing a chronic illness. Finally, the last strength that I'm going to be talking about today will be the increased productivity of healthcare providers with the use of telehome care. So finally, as mentioned, when it comes to healthcare expenses, not only do patients benefit from the use of telehealth services, but so do healthcare providers. This telehome care approach facilitates the ability of healthcare providers to deliver continuous monitoring and adjustment of therapies, remote diagnosis and treatment for patients, and the ability of healthcare providers to oversee large patient populations. Additionally, check-ins become much less time-consuming via telecommunication, making it easier for healthcare providers to fit in more patients and tele-appointments per day. Although the research on telehome care has shown many positive effects on overall health and finances, there are some negative effects of this form of healthcare that should be considered when deciding whether or not it should be a good fit for a particular patient. One of the weaknesses of telehome care would be that telehome care is not suitable in all cases. Although telehome care can be beneficial for many different types of people with a wide range of healthcare needs, telehome care may not be able to cater to all patients or all cases. For example, a patient with strep throat who's seeking medical attention would need a throat swab to verify their diagnosis. This type of testing obviously can't be done via telecommunication and would require a home visit by healthcare staff or a visit to the hospital or doctor's office for the patient. Face-to-face interactions with patients can also be important because healthcare professionals can more easily recognize physical manifestations or signs of a chronic or acute illness that may not otherwise be discovered. According to nurses in the field using this type of healthcare, lack of physical contact with the patient made the visit seem to be secondhand and could potentially result in an inadequate assessment of a patient's needs. Another weakness is technology intimidation. There have been multiple studies conducted with elderly subjects that compare traditional healthcare methods to multiple forms of telehealth care. Within these studies, there is almost always a report of potential subjects who refuse participation in telehealth care because of the fear that they do not possess the technology literacy necessary to successfully carry out the tasks required for effective remote care. Most of the patients who refuse this form of telehealth care do so based on false ideas of what they believe telehome care will entail. Contrary to the belief of these potential healthcare patients, most studies show that elderly patients receiving this type of care are receptive to and highly satisfied with the benefits provided by healthcare services via telehealth. Another weakness for telehome care would be its potential disputes of patient jurisdiction. One of the biggest legal issues with the implementation of telehome care services is the dispute over patient jurisdiction. A study published by the U.S. National Library of Medicine set out to explore an interorganizational and interprofessional controversies that emerge when telehome care is implemented across multiple healthcare sectors. This study found that controversies involved competing claims of jurisdiction, differences in network vision and network architecture, and controversies over knowledge technology. This study shows healthcare providers that these controversies must be handled properly before successful implementation of telehome care services can be designed and implemented. The final weakness of telehome care that I will be outlining in this presentation will be the failure to meet medication regimen requirements. So most of the patients that would benefit from telehome care are the elderly. The elderly just so happen to be at highest risk for improper management of their medications. So while the benefit of telehome care could be empowering patients to take control of their own health management, this can backfire with elderly patients who have a hard time remembering to take their medications at the proper times. The majority of older home health care patients take 5 or more medications daily. Even for an average person, the instructions for chronic illness medication regimens can be difficult to manage. So a major downfall of telehome care could be the fact that they may fail to meet their medication regimen requirements simply because they can't remember to take their medication properly. So while there are many positives to telehome care, I think it's important to focus on the barriers when it comes to improving telehome care for future use. So some of the barriers to focus on improving include integration techniques that do not affect interorganizational or interprofessional jurisdictions. Also, educational strategies that encourage elderly patients to remain open to the idea of telehome care instead of making decisions based on false pretenses. And finally, advancing technology to improve telehome care quality overall. It seems that further research and education on barriers of telehome care implementation may be enough to solve the problems that can arise with this particular healthcare practice.